views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, I'm Dr. Denise Niño. I'm a pediatric intensivist at the Children's Hospital at Montefiore. And today I come with a special program for you from the Children's Hospital at Montefiore, where I have special guests. I have Dr. Nicole Sutton, who's our cardiologist, Dr. Miguelina Germán, a psychologist, and Dr. Michael Uche, a pediatric intensivist. Actually, he was the pediatric intensivist that trained me in those years. And I'm here today to talk about the concerns you have about the safetiness of our kids during this school year. So mental safetiness and physical safetiness. So I would like to talk to you about this today, and I would like you to join us. So please join us later on. Ciao. So here we have a special guest today. He is actually who trained me in my journey as an intensivist. He's a division chief of the pediatric critical care department here in the Children's Hospital at Montefiore. He is Dr. Michael Uche. Thank you, Dr. Uche,
you're very welcome, Denise,
for joining us. Thank you. It's an honor to have you now as I guess a guest in my show. So thank you so much. And I'm so honored to have you because I know you always cared so much for our community. I've seen you, and I've seen you go to our countries and serve in medical missions. You were a great leader in this entire year supporting us. It wasn't easy as a intensivist, as a mom, as a wife, as as all of us as colleagues. It wasn't easy to go through what we went through. So I want to definitely thank you for all your support that you did and for helping us this year.
You're very welcome.
Thank you. So I want to give a different perspective of what happened throughout the years, and I wanted to hear from you, just because you went through so much with us. You had to change the entire, everything that we did, and to take care of all these patients. And right now, still with everything that we went through the entire year, we're still, especially Latinos, more than 50% are not vaccinated. So we're going to talk about vaccinating in a little while, but I want them, our families, to hear your experience of what we all went through together and what you went through as our division chief.
Okay, sure, Denise. First of all, thank you very much. And I'll just say that you are one of the people that I admire most in this world for all that you do, and your endless energy, and your commitment to the community, and your commitment to the critically ill children of our city and our hospital as well. So it's a real pleasure.
Thank you.
It's been the last 2 years have been shockingly different than anything I've been exposed to in my entire career. And I've been taking care, as you know, of critically ill children in New York City for 30 years now. It's shocking how long it's been. And the last 2 years have been so different. COVID has been a whole new type of infection. We all thought in the beginning, oh, it's just another flu, or it's just another bad cold. But it was so much more. And whenever we tried to treat it the way that we were familiar from historically treating it, it always proved to be stronger than us. And so our outcomes were absolutely horrible. And people ranging from young adults to older adults got so sick over a long period of time, and unfortunately we lost so many of them. Those of us that had COVID ourselves have realized what a different and serious infection it's been. What was most upsetting the second year, which was last winter as opposed to the winter before, is we had patients who were so sick, and this was right at the time that the vaccination was coming out. And these patients didn't have the opportunity to be vaccinated since it hadn't rolled out. And we knew that there was a chance of something that might prevent the worst of infections, but our patients weren't able to get it. And the outcomes were really, really severe. And patients would be with us in the ICU for 1 week, 2 weeks, or 3 weeks. And sometimes, just as we thought things might get better, they suddenly got horribly worse and people died. And it just wasn't older people, it just wasn't people with illnesses at a baseline. It was 30-year-olds and 35-year-olds, and it was mothers and fathers. And it was really, really upsetting. And we were using the best medicine that we knew how to use. We have everything here that any place else in the whole world has, and we couldn't pull people through.
But do you remember anything anything outstanding?
I think the most challenging period was in the last winter, the winter of 2020, when we were just learning about COVID and the patients kept on coming in. And at the same time, the patients were very sick, the nurses were getting sick with COVID, the doctors were getting sick, people were working until they couldn't literally not work anymore, and people were totally exhausted. And there was no end in sight. It was just the numbers were still rising, the number of infections per day were rising, and it looked like there was no end. And as much as we tried to be optimistic and happy and know that we could work through it, we had a lot of questions. And we were looking for help, and there really wasn't a lot of help to come. And it really challenged every bit of us. And I'm so proud of the team I worked with. I work with, as you know, I work with a team of 12 critical care doctors and 6 critical care fellows and about 60 critical care nurses. And the professionalism that people showed, the endless amount of work that people showed, the point of exhaustion people worked to, was heartwarming in the face of everything else that was going on. And we did have some victories. We had so many sad days, but we really had some really wonderful victories too. We had patients that we didn't think were going to make it out, and they did, unexpectedly. And that sort of helped us get through the time. It helped us get through the dark days.
And I think also one of the victories is the vaccine. So once we saw, November, December,
Yep.
right, we got the vaccine. And one of the things that we're talking about a lot amongst us and with the families is that we have the vaccine, but still we have a lot of our families that don't want to get vaccinated, a lot of our teenagers that don't want to get vaccinated. Coming from the ICU and living through what you lived through, can you talk to our parents and try to convince them?
Sure. I feel as a doctor and as a parent and a husband, I feel passionately about this vaccine. I think this vaccine is a miracle of modern medicine. It was produced over what we think is a brief period of time, but in reality it was based on research and science that has been done for many, many years now in preparation for exactly this type of worldwide emergency. When the vaccine came out in late of last year and into this year, there was among physicians and among medical people a sense of hope that there was something that we could do both to protect ourselves, but even more importantly, protect all our patients and our spouses, our family members, our parents, our husbands, our wives, our partners, and our children. I eagerly pursued getting the vaccination myself. My entire medical faculty was vaccinated as soon as possible. I was so happy when my wife was able to get vaccinated, and I feel very, very good when my children were able to get vaccinated. I believe the vaccine there are few things out there which one can truly call a miracle drug. There are many medicines which people have called miracle drugs over time that have been developed, and yet I honestly, in my heart of hearts, believe that the COVID vaccinations or the COVID vaccines are as close to a miracle drug as any that we've ever seen. Maybe like penicillin, a vaccination that became available in a short period of time, which is, I believe, life-saving and has reduced the amount of severe COVID in hospitals and ICUs is really such an important thing. I was so happy when my wife and my children got vaccinated. I strongly encourage and passionately ask people to please consider getting vaccinated. I think it is so important as a way to reduce the number of patients that I see in the intensive care unit, to reduce the patients in hospitals, and to try to reduce this infection to something of not too severe quality. Now it's a very severe infection, and I believe that vaccination can really reduce the amount and reduce the number of sick patients that we see.
Thank you so much.
You're very welcome.
Thank you for your time and for your wisdom. Thank you so much.
Oh, you're welcome.
Such a pleasure having
Thank
you
you.
here. So hi, here we have today a special guest, our psychologist. She's a pediatric psychologist, but she has like this huge title, and I want her to tell me. Her name is Dr. Miguelina Herman. Hi, Miguelina. Thank you so much for coming.
Hola,
joining
doctora.
us. Hola.
Hi, doctor.
Hi.
My title is
Yes.
Director of Pediatric
Listen.
Behavioral Health Services at Montefiore Medical Group.
So I am taking the chance right now, the time to ask you questions about what you do. What are you doing, and how have you done? Like, what are you doing here at Montefiore?
So at Montefiore, we have a wonderful program where we place child psychologists and other mental health professionals into your doctor's office. So when you take your child for their checkup, you will be asked to fill out a questionnaire about how your child is feeling, behaving, how they're doing at school. And if your doctor has any concerns, they'll talk about it with you as the parent. And then they'll recommend that your child get additional services if that's what's indicated.
Have your psychologist or department have been able to see certain diseases, certain things happening to our kids in these pediatric practices? Have you seen, do you have any data that you can show us and you can share with us?
I think during the pandemic, we have seen a lot of learning challenges last year, especially with the return to virtual only learning. I think some kids did well with that, and a number of kids did not. So that was a typical referral problem, but also a lot of social isolation. Children and teenagers feeling alone, missing their friends, missing activities, and that's one of the reasons I'm actually really happy that school will be in person this fall, because I think for children's mental health, emotional health, their development, they really need that socialization aspect, where they can be with their friends and do after school sports. It's really important.
What about the anxiety level on kids or diagnosis of depression? Any issues with that?
Definitely. Over the pandemic, I would say teen anxiety and depression, and in younger children, sometimes the way that shows up is they act out. Maybe they don't listen as much. That has all increased, and I would also say grief. When family members have been lost, whether to COVID or to other issues, we've definitely gotten more referrals for children who are grieving.
So what can you tell us, our parents? What advice would you give our parents of, now we're going into this new era where we're going back to school, we still have COVID, we can't vaccinate our kids less than 12.
Right.
Some of our teens don't want to get vaccinated.
Correct.
There's a lot of social media information, misinformation, and really the kids don't want to get vaccinated. So what advice would you give our parents regarding what to do during this school year, before, to go into school and then during the school year? Do you have any advice you can give us?
I do. I think it is a big change to be going back in person, especially if your child was completely virtual all last year. So the first thing I want to tell parents is it's normal if you're feeling worried and anxious. That is totally normal. The second thing I want to say is that even if it's normal, I want you to try to protect your children from your own anxiety. So what does that look like? If you as mom or dad or grandma are feeling worried, I want you to talk to another adult about it. I want you to talk to your partner or your husband or your wife or your best friend, but do not talk to your children about that because they can't control the fact that they have to go back to school in person, right? So it's our job as parents to try to shield and protect our children from our own anxiety.
And I just want to add that I'm listening to you, but I live this every single day in my pediatric practice. Most of the parents come in saying, I want to bring my kid in because his anxiety level is up the roof. I don't know what to do with him. But when you sit down with the parents and you speak to them, you realize that they're the one they're anxious, and they're actually kind of showing that, you know, they're how do you say that, when they're kind of
it's almost, you know, to borrow a term from medicine, it's almost like anxiety is contagious.
Yes, I would say that.
Right?
Yes.
And so think about, just like we wear a mask to prevent, you know, a disease that's contagious from spreading, anxiety can also be contagious. So if you are talking about how scared you are and you don't know if it's the right decision for kids to go back in person, your child is listening to you say that. And, you know, in children, anxiety can manifest or, you know, be displayed in ways like not listening. It might impact their ability to sleep. They may have changes in their appetite. They may start biting their nails. They might get stomach aches, or even panic attacks. And so it's important to let your children talk to you about what they're worried about, but you have to do it in a way that makes them feel safe. So for example, I would say something like, you know, Pedro, I want to talk to you about going back to school. Is there anything that you're worried about? Mommy wants to know. And then stop talking.
Yes.
And let
and
Pedro
listen.
talk. And listen, exactly. Put on your listening ears.
Very good, very good. Any other advice you can give our parents now that they're definitely going back to school?
Definitely. So I think that's my first tip, which is, you know, protect your children from your own anxiety, number one. Number two, find a time when you're calm to have a conversation with them about what they might be worried about, and put on your listening ears. You don't have to fix all of the problems or worries that they might talk about, but what you want to say to them is, we're going to figure it out. You're going to wear masks in school. Everybody's going to be wearing a mask in school. The schools are going to be testing, you know, to see if COVID is present. And there are things that the adults are doing to help you stay safe. And so that's always the best protective strategy as a parent, is to help your children feel safe when they have to go somewhere without you.
That's very important. Thank you so much for that information. I think it was brief, but you really touched on the most important thing, is that we really have to make sure our kids feel that they're safe.
Yes.
And we also have to feel it and make sure we convey that message to them.
Yes. And I often say, fake it till you feel it.
Exactly. I think we all do that,
yes,
especially in this field,
yes,
right?
Yes. Even if you're not feeling it completely, you know, you have to find the way to share it with other adults, not your children.
So thank you so much for taking the time to talk with us today and for giving us this amazing message. I think we really, really need it. I needed it, and all our parents need it. Thank you so
You're
much
very
for getting
welcome.
it. Such a pleasure. Hi, Nicole. Thank you so much for coming.
Oh, thank you for
Sit
having
down.
me.
Thank you. So today we have a special guest. We have Dr. Nicole Sutton. She's a division chief of the pediatric cardiology department here at the Children's Hospital at Montefiore. Welcome, welcome.
Thank you so much for having me.
Absolutely, thank you. So we have a very, very important topic, and for me, I would say it's one of the most important ones because I've seen that most of my parents are coming with their teenagers first to get advice on vaccines, and second of all, most important question is about myocarditis and the COVID vaccine. So I want you to help us understand several things, and we'll take this by steps, but I think one of the most important things is that what is myocarditis?
Sure. So myocarditis is an inflammation of the heart muscle, and that can come from many different things, but it's actually fairly common that it can happen after viral infection.
And how severe is it? Like what? So that the parents are already scared, right? They don't understand it. They've heard all these things about the vaccine. They hear that it's something in the heart's going to fail. How severe is it?
Myocarditis has a big range. It can be very mild, where a child just has some chest pain and takes a little bit of over-the-counter ibuprofen and feels better in a few days, to being so severe that the child or the baby is in the hospital and needs support with machines and medicine. And it's hard to predict which way it's going to go, but myocarditis is just that word that means inflammation. And we have seen with COVID that it can cause myocarditis in the acute period, which is after you get a COVID infection, you have a very high risk of getting myocarditis. There's also a long-term risk of myocarditis in the kids who present with that thing called MISC. And that usually presents like 4 to 6 or even 8 weeks after you get better from COVID. You can present with MISC, which is another version of the inflammation of the heart, and you can have very bad myocarditis. The third thing that we're seeing, which is actually the least bad of all the ones that we've seen, is the myocarditis that kids get after vaccination. In that case, we mostly see it in teenage boys over the age of 16 after the second dose of vaccine. That being said, something like 2 million doses of vaccine have already been given to children in the United States, to teenagers, and there's been very few cases of myocarditis. When they looked at all of the cases in the country of myocarditis from COVID and acute COVID and from the vaccine-related myocarditis, it's 7 times more likely that you'll get myocarditis after getting COVID than that you'll get it from the vaccine. So in general, we think it's much safer to get the vaccine because the risk is much lower to your children that they're going to get sick if they get the vaccine.
So I think this is very, very important that parents understand this information, because there's so much misinformation outside and so many people are talking about myocarditis, but they don't understand that it's much more important to get vaccinated and prevent the myocarditis from COVID, right? Than getting the myocarditis if you get it from COVID vaccine.
It's true. It's much more common to get it from the COVID infection than from the vaccine. If it helps, we're telling our children who have congenital heart disease, who are born with holes in their hearts and problems with their heart, to get vaccinated, because we don't want them to get COVID because they'll get so sick. So I think that if we're telling kids who already have heart problems that it's safe, that it means it's pretty safe for kids who don't have heart problems already.
I agree. I have a ton of patients that come in, a ton of parents that come in with the kids with some congenital heart disease, and they don't want to give them the vaccines because they think it's worse. Something is going to happen to them. So what has been your experience as a cardiac interventionalist, right? That you, so working here at Montefiore, what has been your experience with patients with COVID and with myocarditis here?
So we have actually seen all of those variations here at Montefiore. The first things we saw at Montefiore were actually the MISC cases last year. After the very big spike in adult cases, we then had MISC. We have also had a few cases of the COVID-related myocarditis and very few of the vaccine-related myocarditis. We think that the kids, what we've seen actually, is that the kids who get it with the vaccine have they're much less sick. They're only sick for a few days. The kids who are getting it after COVID are much sicker, and they're in the hospital longer, and it takes them much longer to get back to feeling normal.
And how does a child present?
So the most common presentation after vaccination is that a few days later, usually it's between 2 and 4 days later, that they come in complaining of chest pain, maybe some palpitations, maybe a little shortness of breath or feeling under the weather. And then in the ER, if we know that they've had the vaccine, they will actually do a test to look and see if there's any signs of inflammation in the heart. And we can do a blood test that shows if there's inflammation in the heart, because those are not the most specific symptoms, right? A lot of people might have chest pains, a lot of people might feel funny or tired after they get the shot, so that's what we look for. And if they have that, we'll do an echocardiogram, which is an ultrasound where we take pictures of their heart to see how the heart is working. And so far, all the kids who've had vaccine-related issues, it's been a very mild problem, and it's passed pretty quickly. We usually treat it with some over-the-counter ibuprofen,
Exactly.
and that's it.
Yeah. And the length of stay in the hospital, what has it been about?
2 to 3 days.
So nothing compared to the myocarditis.
Right. So kids with acute myocarditis from COVID are very sick, and they've also seen in the adults who got sick with COVID. The heart problems and the lung problems can be very severe, and those kids and those adults can stay in the hospital for weeks, and they may or may not completely recover. So most of them do recover, but not everyone recovers back to where they were pre-COVID, which we haven't seen post-vaccine. So that's a big difference, because if you get sick from the vaccine, it's like a very mild version. If you get sick from the disease, it's very severe and you may not completely recover.
So what message would you give to our teenagers? They're still so hesitant on getting the vaccine.
And I know as a teenager it can be a little bit scary, because now you're starting to make some decisions for yourself and you have to agree to have the vaccine, so you're thinking about it. And the important thing to know is that when we're looking at whether or not we should do something, we talk about what's a lot of risk to us. So if the risk of me getting sick if I get COVID is, say, 20, and the risk of me getting sick if I get a vaccine is 1, then obviously getting the vaccine would make it safer for me. And that's the way to think about it. You have to say, what are the risks and benefits of doing these two things, and which one is going to benefit me more in my life? And so if you want to stay out of the hospital and not get COVID and not get really sick, getting the vaccine will prevent some of that. Now, vaccines don't make you never get sick.
Exactly.
But they do overall make the illness much less, make you less sick, and less likely to need to be in the hospital, which is really important.
Thank you so much for all this information. I hope you guys listened to Dr. Sutton. She had amazing information for you. And for the teenagers, please go and get your vaccine. Well, thank you, Dr. Sutton, for your time. Such a pleasure having you.
No problem. Thank you for having me.
Thank you.